What is a lateral shift and what can I do? Let's unpack what a lateral shift or list is. I must admit, when I first saw this as a presentation as a novice physiotherapist, it was pretty scary. Often a lateral shift presents with quite severe acute low back pain. And I think anyone who presents with an acute deformity like this, it can be a big shock and concern for them and for you as the clinician. A lateral shift is a common clinical observation associated usually with acute low back pain. There are a few descriptions in the literature about what a lateral shift is. Sometimes it's described as a vertebra being rotated and laterally flexed in relation to the vertebra below. Also, when the body is either actively or reflexively avoiding nerve root related pain. What's interesting about lateral shift is that it's usually a weight-bearing phenomenon. So although they might be really obvious in standing, they may be undetectable when the patient's lying down. So what do I tell the patient? Many people will be well aware of it already. They'll say words like, I feel like I'm standing funny, or I can't straighten up. But for some, it may come as a surprise when you show them in the mirror. Here's a few key messages that's important for someone to know. An acute lateral shift is a common occurrence when people experience low back pain. It's the body's temporary response to pain, where the spine and muscles move to try and avoid particular positions. They do go away on their own as the pain improves, but there are some ways that we can help improve it faster. So what do we do? What's important for us is that many lateral shifts can be addressed and improved through mechanical loading strategies. The timing of trying to correct or improve a lateral shift is usually best undertaken during your physical examination. This is because it allows us to assess the patient's response to loading to then inform our management. So we have two ways of going about correcting a lateral shift. By far the easiest for the patient and yourself is undertaking a self-correction. This allows the patient to monitor and manage the pressure that they put on in the maneuver and how far they go. In addition, this gives us an opportunity to show the patient how to do the self-correction on their own at home. The patient stands with the side that the shift is occurring to against the wall with their elbow on the wall. The opposite hand is on the hip, and the patient gently leans, or more ideally, pushes the hips towards the wall, holding for 1 to 2 seconds, and then returning back, preferably only to the midline. So it's a repeated movement. It's very likely to be uncomfortable, especially at first, but we should continue if centralization of symptoms occur. So this is typically when leg symptoms are reducing. We also see improvement in range of movement or reduction of that lateral shift after 5 to 10 repetitions. With how many repetitions to do, anywhere between 5 to 20 as needed, but the key is being very gradual and letting the patient know that discomfort, especially at first, is okay, as long as the symptoms start to improve. When you've made a significant improvement to the lateral shift, we can show the patient how to detect it using a mirror and show them how to self-correct it for while they're at home. This can be a great way to build self-efficacy where the patient has ways to manage pain through their own actions. The key, though, is don't persevere if someone is not improving with these strategies. Some people with a lateral shift need time for symptoms to settle. If things aren't improving with correcting their lateral shift, don't keep pushing it. So let's summarize a few key points from looking at a lateral shift. These are common and temporary responses to pain, but can still be really alarming for you and the patient. Use a patient-generated approach to correct the lateral shift, as the patient then has the ability to do this themselves and they can monitor their own symptoms. Correcting a lateral shift might be a key approach in your exercise and self-management plan for someone with acute low back pain, but don't persevere if it's too painful or not effective for your patient.